For several decades, Kenya was a leader among African countries in providing family planning services to its people.
The family planning program was very strong. There was a lot of donor support in the area of family planning in terms of right from buying the commodities, advocacy issues, BCC materials, all those.
Due to the massive population programs put in place by the government, we were able to have fertility transition start somewhere around 1989 when we recorded evidence of fertility decline.
At one point, we had about 1,500 CBID agents in the country, educating women and men on the need for family planning, explaining the family planning methods, side effects, and supplying pills, condoms, jellies, and creams to women.
The use of modern contraception among married couples increased from only 4% in 1978 to 32% in 1998. As a result, the average births per woman or fertility fell from 8 to under 5 births during that 20-year period. This trend towards smaller families was associated with higher incomes and economic growth in Kenya.
Family planning contributes by allowing women to participate in the achievement of Millennium Development Goals and improves their health.
The Kenyan government and a large number of grassroots organizations placed a high priority on providing these services, which helped women have their desired number and timing of children and also improved the health of mothers and their children. The family planning services provided in clinics and in the communities were a role model in Africa. Health professionals from around the world came to visit and observe these programs.
We used to have people in the villages giving information on family planning and providing brochures on family planning and providing condoms and pills.
However, in the last 10 years or so, there has been a significant erosion of these impressive gains. Attention has shifted to other health and development concerns, even though, ironically, attention to family planning would make the achievement of other health and development goals more feasible.
HIV being a very major pandemic, resources were shifted from family planning and other programs to be able to tackle that very critical concern which, in our community.
Contraceptive use has not increased measurably since 1998, and fertility rates have remained more or less constant.
The other challenge that we really face in this country is commodity insecurity. And when I say commodity insecurity, I mean stockouts of contraceptives. And that also affects continuity of the methods.
Hii huduma tunazipatanga mara nyingi kwa shida kama sasa. Saa hii ukienda unaweza kuta huko ukifika unaambiwa dawa zimeisha, wakati mwingine shindano. Sasa unajua hapo kumeleta shida sana.
According to the findings of the 2003 Kenya Demographic and Health Survey, there has been a worrying trend in Kenya's contraceptive use and births per woman. This situation may result from a number of factors, such as the failure to sustain and manage family planning services in the country, and the failure by the government and other stakeholders to reinforce family planning policies and services in the wake of other health-related issues that continue to emerge.
The government, having been comfortable with maybe the previous support by partners, did not immediately respond to this shift of programming and financing to actually put in government funds. It's only about 3 years ago that the government actually is putting budgetary allocation for family planning.
kwa kuwa watu ni wengi sana wale ambaye wanahitaji ndawa. Shida zile sana sana tunapata kama community health workers ni ya kwamba hizo mandawa hazitoshi kwa sasa. Iko wakati ule mbeleni kabisa ilikuwa inatosha, tulikuwa tunaletewa nyingi sana na serikali, lakini kwa siku hizi haziko za kutosha.
Katika kijiji changu kulikuwa na karibu watu 40 wenye ambao nilikuwa nahudumia, hasa sio mama sana, walikuwa umri ya kadri. Bado niko na wale wateja ambao wananiulizia mambo yetu inaendaje. Sasa naambia nyewe, unaona kliniki ambayo tulikuwa tunahusika nayo iliweza kufunga, sasa imeweza kuwa ya mtu binafsi. Hasa ukienda huko utapata gharama sio ile ya kawaida ambayo tulikuwa tunaweza kupatia.
Due to the weakening of family planning services in the country, many cases are now emerging where parents or families are having more children that they can afford to provide for.
Ni vizuri wakipanga, lakini wengi wanakufa ukimwi. Sasa watapanga hiyo uzazi na watu hao wanakufa, wagani watapaki kwa hii nchi?
Naomi Kavaya, who lives in the Kibera slums of Nairobi, is a classic example of the many people who are now suffering as a result of the slowing down of the formerly active family planning campaigns and services that existed in this country. Today, she is a widowed mother of 10 surviving children at the age of barely 30 years. At such a relatively young age, the health risks to the mother and the children alike are very high, not to mention the economic burden of comfortably raising and caring for such a large family.
Mtoto wangu wa kwanza nilimzaa 1986. Watoto wote kwa jumla walikuwa 11. Na wamekufa 2, wamebaki 9. Kuna wale hawasomi, kuna mwenye amemaliza form 4 hana kibarua, kuna mwenye ako form 2 hata hajaendelea na kusoma, hako tu. Alafu na hawa wadogo.
Fertility is a major determinant of the population growth rate, and the continued, relatively rapid rate of population growth presents major challenges to Kenya's overall development. A challenge that must be addressed if Kenya's development vision of 2030 is to be realized.
If the economy is growing and the value of the goods and services in the economy is increasing and the population is falling, what it means that you have more wealth at your disposal. Yeah? And with this more wealth, you can be able to do or carry out many activities, including building the requisite infrastructure to cater for that smaller population.
The situation is not good, and we really need to push on with the repositioning so that we have better indicators. And in this case, I'm talking about a total fertility rate, which is actually on an upward trend. We are talking about the contraceptive prevalence rate, which is plateauing at 39%. We're also talking basically of high maternal mortality. We are having 414 women dying, out of 100,000. And all these indicators really need to be improved upon. And this can only be done if we do have a repositioning of the family planning.
Unless, as a country, we make a very clear decision to reposition family planning, to allocate resources for family planning, to advocate for family planning, we are unlikely to achieve, for example, the MDGs.
If we're looking at the kind of Vision 2030 goals and the programs coming out of the economic recovery programs of Kenya, we're seeing the GDP per capita increasing in real terms, but to consolidate and expand on that, if we can maintain a lowering of the population growth rate, then we're going to be seeing more and more benefits.
Most people, regardless of their social and economic standing, are aware of the benefits of planning their families.
Bringing up 2 kids is quite a challenge. I think now my family is complete.
Mimi ningekuwa na watoto wengi, ningekuwa na shida. Ningekuwa na shida ya kutafuta vyakula kwa sababu mashamba yenye tuko nayo itoi chakula kwa njia mzuri. Sasa ile kidogo yenye napata imenitosha na watoto wenye niko nayo 3.
The current focus on control and management of HIV and AIDS in the country has left most family planning providers with fewer resources and products to satisfy a responsive clientele that they had served over the decades.
Towards the end, till the end of April of this year, we had 420 CBDs, call them field workers, call them community-based.
The OCBDs are still coming here to take pills to the community in spite of no donor funding, no even some small ticket or bus fare for them.
Community health workers were adequately trained and provided valuable family planning services, often bringing information and supplies directly to the people's homes. Today, they have neither the resources nor support to enable them serve their clients in the community. With a shift now on HIV and AIDS, family planning has taken a secondary role, with the community health workers using their own ingenuity to infuse a little bit of family planning education. The increased family planning use that was very significant over 20 years needs to be revitalized. Family planning should be fully integrated in the programs on control and management of HIV and AIDS, for example, the prevention of mother-to-child transmission programs.
Family planning should go a long line with HIV/AIDS education, with immunization program, nutrition program.
The fact that we now have a draft national reproductive health policy, to me, is really a success, which is very, very important. And also the realization that as funds for family planning and reproductive health are dwindling, we could actually tap into the resources of the HIV and AIDS. And therefore, this calls basically for the integration of family planning, reproductive health, and HIV and AIDS.
The many family planning programs that the Association of the Council of Imams and Preachers were running have since stalled due to a lack of support both from the government and development partners. They had a widespread network of family planning programs that cut across the entire coast province.
As a Muslim society, we have what we call the natural family planning, which does not involve any devices, which is cheaper to upkeep the safety and the health of a woman, to have that natural spacing of the children.
Tuna fursa kubwa ya kila wiki tunakutana na waumini siku ya Ijumaa. Mbali na hivyo ni kwamba tunaweza kukutana nao siku moja mara 5.
Institutional support to faith-based organizations needs more resources, as they have been very effective among their faithful.
Kwa hivyo jambo muhimu ni kwamba tunataka usaidizi, tuwe na nguvu ya kupata usafiri, transport, tupate vifaa, tupate namna ya kutoa mapamphlet, cassette. Networking yetu imeshikana vizuri kabisa, na tumeona katika majaribio yetu kwamba hii kazi sio ngumu. Almuhimu tuweze kupata usaidizi wa kutupeleka mbele na kazi itafanyika vizuri sana.
The Christian churches and their organizations have always had a strong link with their faithful. This provides a beneficial entry point for renewing support for family planning services and programs.
The church has its own position, it has its own stand. And the other side, which is not the church, has also its own stand. And each one has to make his or her own impact. Natural family planning, we have the cooperation with the nature itself. And it allows these two people to accept even and respect the other person when in fertile or non-fertile periods.
Under family planning, we are telling families or congregants or the community at large that a household has to have a family that it can care for. And also we refer them to the Bible that having a family that you cannot care for well, that's an abuse before God.
These are the multi-sectoral initiatives that need to be revived and supported for family planning services to be put back on course. Despite the stall in contraceptive use, it is gratifying to note that many people in Kenya recognize the benefits accruing to their livelihoods when they embrace the principles of planning their families. Family planning service providers need to be empowered to harness this existing knowledge amongst the people. Reaching people and communities with proper information and messages about family planning is important. Health facilities need to be adequately equipped and made accessible to the people. Many people have misconceptions about family planning methods and the effect on their health. Rehema Ali is 43 years old with 16 births, out of which 8 are surviving. She used family planning methods but believed they caused health complications, so she stopped. Clearly, this is a case where proper guidance was not given to Rehema on the type of family planning methods that might have been suitable for her.
Family planning, mimi kutumia nikaona siwezi maisha ya family planning. That's why mimi nimezaa 16.
Young people are among the most vulnerable in society when it comes to reproductive health. Many programs previously existed that aimed to create awareness among youth about their sexuality. Many youths are falling prey to risky behavior that predisposes them to unwanted pregnancies, early marriages, and the risk of contracting the HIV virus.
When you look at study after study, you look at government data, it shows you that a lot of young people are already having children. 1 in 5 in some places, even higher, almost 3 out of 10 if you're looking at 29% figures. Like
60% of the population is youthful, and there are very potential clients there who are low parity, who need the type of family planning, who doesn't have information at the moment.
When you're talking about young people, there's very little investment. We have policies in place in this country. We have the Adolescent Reproductive Health and Development Policy. We have the sessional paper on population and development. We have the guidelines and protocols on service delivery to young people. But we have no services. Only about 12% of health facilities provide services to young people. So there's a mismatch between what we are saying in our policies and what we are actually doing.
It is imperative that the government, policymakers, leaders of non-governmental organizations, faith-based groups and the private sector revitalize family planning services in all their development planning initiatives for the Kenya Vision 2030, Kenya's long-term and comprehensive development strategy, to be realized.
I urge the policymakers, the parliamentarians and you at NCPD to ensure that providers like us get the necessary backup.
This will require total commitment in analyzing and implementing the following. Establish what policies exist and their effect on contraceptive availability and use. Assess the budgetary allocation for reproductive health services, including family planning, to ensure it is adequate to meet current needs.
The government itself to see the family planning program as an integral part of sustainable development and fund it.
So we formed ourselves into a caucus group that is geared to persuading and working with the Ministry of Health to increase funding to attain the Millennium Development Goals in terms of improving the death rate of mothers at birth. The ministry has been increasing funding, and to the extent that last financial year there was about in excess of 400 million shillings in reproductive health.
The key issue is that how do we ensure that reproductive health is actually given a priority when it comes to the allocation of the resources. And that's something that the ministry is really looking at, and we do hope that we are going to have favorable outcomes from that perspective.
Focus both on supply of and demand for contraceptive, that is procurement and distribution, with a particular focus on ensuring adequate supplies in rural health facilities.
If we're going to see poverty significantly reduced, family planning has a major role to play in terms of making contraceptives available, informing people about how to access them, and giving them the choice to limit their families to what they can afford, and to make sure that healthier family life proceeds on that basis.
Identifying gaps or weaknesses in training programs for health workers and effective supervision of these workers, as well as staff motivation. Identify target audiences such as sexually active youth, married couples and men, and intensify information campaigns tailored for these specific groups.
It is a high time that we stopped focusing family planning or contraception just on women and looked at couples.
We want the total support of men at different levels in every household so that we can have better outcome in the programs of family planning. Educating the public and sharing information, having dialogue with the community, and engaging the political leadership so that everybody has a space to contribute to the debate and also to make a choice. We believe that will help.
Analyze the effect of the shift in funding from family planning to HIV and AIDS, and explore the possibility of integrating family planning programs with HIV and AIDS programs.
We need to restore some kind of balance. And as I was saying earlier, to get a more integrated national program where HIV, AIDS and other aspects of sexual and reproductive health, including family planning, are brought more closely together and reintegrated. I think that's the way forward.
Now we would like to have both HIV/AIDS program interfaced with some of the programs, including family planning.